Hello, I'm Dr. Humeira Badsha. I'm a consultant rheumatologist with over 30 years of experience treating all different types of arthritis. Arthritis, as you know, can be an autoimmune disease. There's rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis. And over the years, I found that not only is our medication really important, but diet and exercise are essential. So when you ask doctors, what food should I eat for arthritis? Often we don't give a good answer because of lack of good training in this condition or evidence. So I've tried to summarize in several videos the evidence behind arthritis diets, and I'm going to share my screen now, and we will talk about best foods to eat for arthritis. And if you have been following my videos, you'll see that there is another video which goes into more detail about the best diet for arthritis. And also, I have recently released a video on the worst foods for arthritis. I've summarized most of the scientific data in this peer-reviewed paper. It's published in the Rheumatology Journal. It's available online, but it is, of course, meant for the scientific community, so it could be a little harder to follow. So I just want to summarize my previous video in this one slide. If you need more detail, please do go to that video. So the foods to avoid, and there is scientific evidence for each of these foods, which I've also summarized and put in the references in my other talk, but it's mainly gluten, all dairy products, especially cow's milk, because it contains a protein called casein, sugar, red meat, sugary drinks, any sugary drinks, Coke, and even avoid Diet Coke because the chemicals in Diet Coke can worsen autoimmune diseases, processed foods, salt, and omega-6 in oily and fried foods. Now, all types of autoimmune arthritis and lots of diseases are influenced by the gut microbiome. What we mean by the gut microbiome is the bacteria which exist in your gut. There are helpful and beneficial bacteria which reduce inflammation, and also other types of bacteria which are linked for higher risk of arthritis. For instance, they found a bacteria called Prebiotic, which is more prevalent in the gut or the intestines of patients with rheumatoid arthritis. So how do you build back the healthy bacteria? A lot of things destroy our gut bacteria, especially eating the wrong foods, which we detailed in the previous slide, and also taking antibiotics. So very much research has focused on the gut microbiome in recent years, and we know that a fiber-linked diet is linked with a lower risk of knee osteoarthritis and pain, and also is beneficial for rheumatoid arthritis. When we talk about fiber, men should take about 30 grams of fiber and women around 25 grams per day. So these are some sources of fiber-rich foods. Apple with the skin on, one medium apple has almost 5 grams, a banana has 3 grams, a boiled cup of green peas has 9 grams, one potato with the skin on. So everything apple with the skin on. Potato with the skin on has 4 grams of fiber. Quinoa has a cup of fiber, 1 cup has 5 grams. A brown rice cooked has about 3.5 to 4 grams. But the most fiber-rich food are lentils. Boiled 1 cup is 15.5 grams. So you can eat dal or lentil soup. And black beans is similarly, 1 cup of beans is 15 grams. So there's a lot of theories and urban legends that you shouldn't eat lentils, and lentils or dal promote pain, joint pain. And this is just not true. It's really important source of protein, especially for vegetarians and vegans, and an extremely important source of fiber. So when we talk about prebiotic foods, we're talking about foods which build the atmosphere or the area where your gut, the good bacteria can proliferate and thrive in your intestine. So these are some of the foods. Onion and garlic, especially raw onion and garlic, can be really beneficial. Apples and bananas, we already talked about. Leeks and asparagus, oats, cocoa, flax seeds. So all of these are some things which you should improve and add in your diet. Flax seeds especially is an extremely good source of omega-3, and especially for vegetarians, this is very important to include. So some people would take probiotics. The jury is out on probiotics. There are some small studies which show that you can add probiotic capsules to improve not only gut symptoms, that there are studies which show that it improves gut symptoms and the indigestion, bloating, and gas, but also some limited evidence for improving symptoms of rheumatoid arthritis and other types of arthritis. Now, if you do take a probiotic, this is what you should look for. The dose of the probiotics, the number of organisms should be around 50 billion per day. Now, some people may have diarrhea with this dose, so then decrease your dose to about 10 billion per day. You need to include a probiotic which has at least 10 different strains. Try to get an acid-resistant capsule. Look for that, because if the probiotic, the capsule is consumed by the acid in your stomach, then these bacteria are also destroyed in the stomach sometimes and don't populate your intestine, which is further down. Try to see whether the capsule also includes some prebiotic fiber, and look to see, make sure that Lactobacillus casei and Lactobacillus acidophilus are included, because the studies have been shown that these two are particularly helpful for rheumatoid arthritis and other types of autoimmune diseases. Now, we're talking about some foods. Things like ginger and ginger extract can be extremely useful for preventing pain. People who take ginger capsules found that they were as effective or useful as painkillers in treating pain, especially of osteoarthritis. But some people can have some gastritis or stomach burning from it, so just be careful with ginger. Turmeric especially, there have been lots of studies of showing how turmeric is useful as a painkiller and an anti-inflammatory. The dose, a lot of people include turmeric in the diet. You should use pure organic turmeric. And yes, this is very important to use with our cooking. But if you're actually treating pain and treating arthritis, you need a very high dose and concentrated form of curcumin, which is the active ingredient in turmeric. So look for a capsule with curcumin, about 1,000 milligrams per day. This sometimes relieves pain as well as anti-inflammatory drugs. You may need to go up to 1,500 milligrams per day, and look for a capsule which also has black pepper extract, that can be particularly beneficial. Vitamin D, most people are deficient. Vitamin D deficiency contributes to autoimmune diseases and having active disease when you do have autoimmune arthritis. The primary source of vitamin D is in the sunlight, but many of us don't spend enough time in the sun, or we use sunscreen, or have pigmented skin, which can hamper the absorption of the ultraviolet light. Vitamin D is actually already in your skin. You need to keep your vitamin D level in your body about 30 nanograms. So you may need to be taking a supplement, especially if you're not spending enough time in the sun. And the dosage of the supplement is anywhere from 1,000 to 5,000 IU per day. Omega-3, many studies have shown at a dose of 1,000 to 3,000 milligrams per day, it decreases arthritis, inflammation, and pain. It improves the effect of certain medications for rheumatoid arthritis. It's found in foods such as salmon, mackerel, sardines, and trout. If you're vegetarian, walnuts and flax seeds are excellent sources of omega-3. Now, if you watched my previous video on foods not to eat, omega-6 is a food which you should not eat, because in the body, we want to maintain a certain ratio of omega-3 is to 6. And hence do not take supplements which are omega-3, 6, and 9. If you want to decrease inflammation, take a supplement which has pure omega-3 and add flax seeds and fish oil to your diets. Fruits, several fruits have been shown to be particularly helpful for arthritis. Grapes have resveratrol in its skin, so eat grapes with the skin on, and it has a plant compound also called proanthocyanidin, which reduces inflammation. Pineapples have bromelain, which decreases rheumatoid arthritis symptoms and inflammation. Cherries and cherry juice also decrease inflammation, especially for gout, very useful for gout. Berries, in one study of 38,000 women, those who had 2 servings of strawberries per week were less likely to have inflammation. They have quercetin and rutin, which are very important for your health and also to decrease arthritis-related inflammation. Broccoli, sulforaphane is a compound found in broccoli, and there are many studies which show that it can decrease inflammation in rheumatoid arthritis, and other types of cruciferous vegetables are also helpful here. Spinach is an extremely important nutritional food which you should include in your diet. It's high in camphorol, which decreases inflammatory agents associated with rheumatoid arthritis. Spinach and kale also are excellent sources of calcium, but please avoid overcooking them. When you overcook it, then you do not get much of the benefits. Olive oil is something which can be helpful, sometimes as beneficial as fish oil. It reduces inflammation in groups of people. There have been studies done on olive oil. And while we're talking about olive oil, I just want to jump across to talking about cooking oil and how do you cook. You need to know about the smoking point and the oxidative point of cooking oils, and you need to cook with oils that are stable at high heat. So basically avoid vegetable oils, canola oils, which are high in polyunsaturated fats. Also avoid cooking with fish oils and flax oils. Coconut oil is resistant to heat and is relatively safe, and olive oil is mostly composed of monounsaturated fats, so it is safe to use. Also, avocado, safflower oil, and sesame oil are safe options. At this point, I would like to end my talk by telling you all, whatever you do, do not eat processed foods, do not eat excess red meat, try to adopt a healthy diet, lots of vegetables, fruits, and fiber, and you will see a difference in your arthritis symptoms. Thank you.